Welcome to. You all set on recording? Okay, great. Welcome to September. Let's go ahead and call ourselves to order here. For privilege of the floor, I do not believe we have anybody, correct? Miss anybody? Okay, great. So let's go ahead with voting on approval of the minutes, which were part of the packet or are part of the packet. So could I get a motion to approve as written? I have a first from Samara and a second from Frank. Any additional discussion or edits on these? I don't think so. Conversation. Okay, all in favor as written. And that is unanimous. Okay, so we also have we're changing up the order a bit of the agenda. Hopefully everyone noticed that. So we're going to take care of our new business, which are our enforcement actions and our administrative actions first. And we have a relatively large number of enforcement actions because we haven't met for 2 months here. And so let's go ahead and take a look at those. Hold on, I can't get my computer to connect to the internet. So thank you for the copy. Okay, lots of fun stuff in enforcement actions today. Okay, so our first one up is the Hanshaw Village resolution. So let's go ahead and get a motion to approve as written. First from Melissa. Second from Samara. Okay. Liz or yes, Liz. I was like, is there a skip here? No, okay. Liz, is there anything else to add on this? Do you want to talk about this at all?
Yes.
Okay, great.
So actually I have another thing. I didn't make copies for everybody. So I did have, there was a change in the case summary. So I passed that out. That is for this resolution. So that it's some additions and one correction. So just so you know, that's what will be in the final copy of the order, but no changes to the order itself.
This thing right here that you handed us. Okay.
And I have a couple of copies of this if anybody wants to see it. So so don't take one unless you really are interested, I guess. So Hanshaw Village, I think, has come to you guys a couple of times. We have had water issues with them. And that will probably be discussed more maybe next month. There's a lot of conversations going on regarding that. There's larger conversations going on regarding the sewage system with DEC. And we think the town of Dryden was planning on submitting a CDBG grant so that municipal sewer could go out to Hanshaw Village. That is separate from what is before you. They also have had issues with surfacing sewage kind of individual lots. So that is what the proposed action is about. So it's separate from the larger actions. And I thought you might want to see, I passed around the map. It kind of just shows you the layout of the park. You get a sense of magnitude of it and where some of the issues have been popping up kind of all over. So
these are all sewage on the ground markers.
the red dots.
Okay.
Yes, locations where sewage has been observed by staff.
Okay.
So we've got the proposed resolution with a $2,500 proposed $2,500 penalty, and essentially saying they need to be prompt in addressing it. Probably the main things connected with this particular resolution.
And I just had a question. Did they pay the April one? Because this was in here too, so I just wasn't this resolution.
I do have it marked. So that I can check that.
Yes, I think my question was, do they owe the 400 and the 2,500?
No, we would have included it generally. They might take.
While she's looking for that, any discussion or questions from board members?
Yeah, that would be.
Okay, and then my second question was actually, because number 2 on this one is about putting up corrective fencing,
Yes.
which is also on the current one. So is that just standard because every time there's leakage, you need to put the fencing up, or you
Yes.
did it? Okay,
No, it's, yes, it's for.
so this is different fencing than what we had them do before?
So whenever they have at each of these little red dots, they needed to put up fencing.
Got it.
If they have another little red or area that would be a little red dot, they'll need to put up that fencing and.
Okay.
stuff.
Okay, yes.
Is there signage as well?
No, it's just keeping, limiting access, right?
Any other questions? Right, are we ready to vote?
It's not kind of the same.
Well, that's what the lines.
No, that was
Oh, you ready to vote?
everybody.
Okay. Okay, all in favor as written? And we're unanimous. Okay, so second one, I think somewhat similar. Second one is the Newfield Estates. Right? Okay, Newfield Estates, so, if we could get a motion, to approve as written. Somebody, one from Frank. First from Frank, second from Samara, or second from Samara, sorry, first. Okay, anything additional discussion on this?
General question, how are the monetary fees like? Is it the Tompkins County or the state that defines how much is charged as a fine?
It's technically you guys. The Board of Health is the one who approves the fine. Generally, we propose, for the food service program, we have a risk-based matrix that we use to determine the proposed penalty. In situations like this, we generally propose a penalty of $400 unless it's intentional, and then we'll kind of increase it to $500. This is a difficult situation. There are health issues involved. And so this was the proposed penalty of $400.
Questions? Start. All right, all in favor? And that's unanimous. Okay, we're switching gears now to food service establishments. The first one is Donald's. So we could have, if we could have a motion to approve this written. The first from Samara, second from Ed. Liz, anything to add to this that was already in there?
No, it's a $500 fine. There's a sewage liquid waste on the floor.
Any questions or conversation about this? In favor? And we're unanimous again. Next food service establishment, although before I put anything under motion, you gave me something different. So what is it that?
This is Little Venice.
This is Little Venice.
So on Little Venice, we realized when I was reviewing this, that the language in the stipulation agreement that the owners agreed to and signed was different than the language that was in the Board of Health resolution. So we've revised the Board of Health resolution to reflect the language in the stipulation agreement. which it should, which is specific to the situation that was at Little Venice, which is related to the, more mainly to the equipment. Right, and the other one is more of a general, like, hot holding, cold holding violations.
So this is what we're voting on, is what you handed out to us.
Yes, I would like, so we would like the revised resolution to be what was voted on.
So this is, I'm gonna ask for a motion to approve as written, this one. The revised version. Okay, I have a first from Ed. Second from Frank. Okay, any additional discussion on this one for Little Menace? Anything you want to add? What's already in here? Any questions from board members? Okay, let's go ahead and vote. All in favor as written. And we're unanimous. Okay, next one, next food service establishment is for Eat a Pie. Is that right? I realized it. Let's go ahead. Put it under a motion to approve as written. First from Melissa. Second from Frank. Any additional information on this one? Liz, from your perspective, it's pretty straightforward. Any questions from board members? You have a present love? Would you like to ask a question?
It's my usual.
Okay. All right, then let's go ahead and vote to approve. All those in favor? Anyone? Oh, that's unanimous. Okay, another food service establishment. Let's go ahead and put this one under a motion to approve as written. This is for JoJo Cook. This one is for JoJo Cook, just to make sure we're all on the same one. A motion to approve as written. I have a first from Samara. Second from Melissa. Liz, anything to add to the materials that are already here?
No, holding violation too.
Oh,
Yeah, Frank?
uh, So Eat a Pie had $400 and these guys have $200.
So for our food service establishments, we do have a matrix that is where the fine is proposed. It's on the level of risk and the history of the facility. It was something that was reviewed. I'm not sure if it was formally approved because they knew it more informal, but it was reviewed by the board in the past.
Okay.
We can present that if you want to see it.
No, I'm just curious why.
It's a calculated response. This was a low level violation that resulted in a $200 penalty.
Any other questions? Okay, all in favor? And that's unanimous. Okay, so that's it for our resolutions. Did I get every single one of them, I hope? Okay. Okay, computer is working now.
Yeah, there's one more.
Oh, there's, no, that's different. That's different. That's done. Okay. So, okay, Liz, so we're all good on this. So now we're going to tackle the administrative action. This is a request for a waiver. So before we discuss it, let's go ahead and put it under motion to approve as written. Okay, first from Melissa. Second from Samara. All right, so Liz, let's go ahead and open up for discussion about what this is.
So Ithaca expanded their facilities about 5 years ago or so and added the Art and Event Center, which a number of you are probably familiar with. And they put in temporary deluxe or whatever nice toilet facilities, and then put in one of these large holding tanks so that they would not have to pump like after every event and stuff like that. So they put in these large holding tanks. The board approved a 5-year waiver back then. I think it was in 2020. That waiver has expired. And so now it was, we need to the board either needs to extend the waiver for it or not. So what environmental health, the Ithaca proposed a permanent waiver. we are proposing that it be a 5-year waiver with some conditions. We want them to be sure to submit a service contract, which we have not yet received from their certified waste hauler. You know, it's a hotel and a restaurant, so there'll be consequences if they aren't pumping the tank, but we need that for our formal files. And we also want the facility to notify us if there's any changes in either the footprint of this facility or in the waste flows in their system in general. Before they expanded the facility without notifying us, which then had some impact on where there was space for a sewage system, for example. So that was why we added that last addition, which we would like to the waiver. Because their long-term plans, I think, are to have a larger hotel and a new sewage system. As noted in their documentation, they're currently having some difficulties with Ulysses in having that.
Right.
Are these portable toilets permanent?
No, I mean, it's they're outdoor.
No, I know, I've seen it, but do they intend to leave it there for the 5 years of this?
Yes, they intend to leave it there, and yes, they might probably intend to leave it there indefinitely to service that, the event center. But eventually, we would want it hooked up to a revised, expanded sewage system would be our goal in environmental health, and not use the holding tanks forever.
But so the hotel has a septic system, right?
Yes, it does.
So would the goal be to put a septic system for the garden area?
So they would need to reevaluate the facility to determine, like they have proposed different things over the years. Like whether they do one comprehensive system that handles all of the flow from their facility, or whether they have a system that only handles part of it, right? There would need to be an engineering analysis and report for what would happen in the future.
Wait, hold on, Melissa's first, and then you.
No, I don't know enough about this, but is there any risk about having a temporary holding tank for more than 5 years? Or are they pretty solid? And if we extend it for another 5 years, does that put us at risk?
So our concern a lot of times with holding tanks, or are they going to be maintained and pumped? This is a facility where somebody is there. They don't want any issues with their holding tank, so they should be maintained. So for this facility, we don't have that level of concern. And they are, will require them to have a service contract to pump the tanks. So in environmental health, we are okay with supporting the waiver for another 5 years.
So if they have a septic system, tank system already in place, they don't have connection to, or they won't have connections to a sewer line, correct?
Correct.
Correct. So is there any significant difference between a septic system and holding tanks in terms of their longevity? And because you do have to pump out septic systems.
So this is a waiver for 2 tanks. One is 5,000 gallons and the other one is, I think, 1,250. The 5,000 gallon tank is designed to be the septic tank of a larger system, if that is ever installed. So it's the same piece of equipment. It's just being used differently, and septic tanks you pump out every 3 years. This, they have to pump out much more often.
One last question. They actually have the space for a septic system in field and all that, because
If they want to expand, they will need to find a way to treat the sewage from an expanded facility. There are like package plans. There's more involved ways they could address this if they could not find the space. They put in an enhanced treatment unit with their current system to increase the treatment effectiveness without really expanding the footprint of the current system. And so there are different options that they can look at.
an area that.
Well, that is why one put in what the condition added, that they let us know before there are any changes. Questions?
So all in favor, and what we're in favor of is the conditions that was just proposed, which is 5 years. That they have to produce the current service contract and that they have to inform the health department if there's any additional expansions. So all in favor of that? We are unanimous. Okay. We are going to turn this meeting over to the fearless leader, Jenny, to walk us through the
Yeah,
next part of the presentation.
so we are taking a new approach to the Board of Health meeting this month. We sort of sat down as a leadership team and talked about how we could bring topics or ideas that were maybe more collaborative in nature, and particularly things where we felt like we could use some guidance or some of your subject matter expertise in different topics that maybe we're finding tricky to move forward with, or we're, you know, there's several paths available to us and we are just interested in your expertise on what your feedback would be on different things that we could do. That feels vague, but you'll understand when I start talking about what we're actually going to talk about. You know, I think the structure that I sort of proposed with our team is doing this on an every other month basis. So this month we'll have kind of a deep dive topic. Next month, we're actually going to continue a little bit on this topic, but we'll have sort of the more traditional round robin updates from programs. And then in November, we'll do sort of another deep dive topic, sort of see how that works. I think, you know, we're not trying to steal any thunder from all of our wonderful division directors, but we do recognize that you have their updates kind of in your board packet. And so we wanted to try to use this space as a time to have more of like a discussion on topical situations. So with that, we are going to spend today talking about youth vaping. And we have a really wonderful presentation from several folks teed up. And then I want to highlight that we're actually going to continue this discussion next month. Skip couldn't join us today. Shauna also couldn't join us today. And there's several challenges around youth vaping and enforcement that we really want to dive into. And so next month, we're going to bring that kind of back to the table. So you all have a month to do some of your own additional research on this topic. And we'll move actually into an executive session for that piece, because there are things that are related to the enforcement that aren't appropriate for a public meeting. And so at our next meeting, we'll move into executive session. We'll kind of bring this topic back up, and then we'll dive a little bit more into the challenges. But for today, we're going to focus on the prevention work that we're doing, the data that we have, and some of the enforcement work, sort of what it is and how it's working. All right. Any questions from you all? All right, great. So I will hand it on over. Who's going first? I forget who's at the top.
Technically me.
Okay,
I got the
all
first
right.
couple slides.
Brandy, you want to hop on over to the front, or what's the best?
And you're gonna be doing the slides, Amber?
I can.
I don't know how the slides are working. Hello, everyone. My name is Brandy Remington. I am the youth development coordinator and coordinator of substance use prevention and intervention for PST BOCES. So I serve all of the school districts throughout Tompkins County. And I work really closely with the Community Coalition for Healthy Youth. Is a community coalition here in Tompkins County where we focus on prevention as a joint task force of youth service providers. And when we say prevention, we're talking about substance use prevention, and we're talking about mental health prevention as well, because we know the two of them are very closely linked. We're getting the slides sometimes. So that is my role. And I'm going to start us off by talking about the data. So every 2 years here in Tompkins County, we do what we call now the CLIDE survey, which is the community level youth development evaluation. Students in grades 7 through 12 at all of our school districts participate in taking this survey every 2 years. So the data we're going to show you is feedback, responses, anonymous responses from the kids here in Tompkins County. And the other thing, as we're pulling up these slides, is that it's really important to know that I work really closely with Amber here at the health department as we're talking about prevention education
And as we're trying to break down some of these conversations around accessibility. So this presentation is really focused on what's the prevention education that's happening and what does accessibility look like? Because we know that prevention and cutting down off access to substances that our young people shouldn't have need to work hand in hand. One without the other is not going to get us the results we're looking for.
I just have to both two just in case.
So the data that I'll be sharing is right from 2023. So we are doing the Clyde survey again next month in all of our school districts. So we'll have fresh data from our students for 2025. But we do have data going back all the way to around 2002. So I have lots of longitudinal data. We are talking about vaping today and youth vaping. Our youth vaping numbers only go back to 2018. But if we're looking at other nicotine substances or other cannabis substances, we have data for that going all the way back to around 2002.
Getting there, Brandy. The amount of information you're rattling off the top of your head is very impressive.
It's gonna show up in your.
It's open
Browser.
in Edge, yeah.
Right, so you won't see it till you're in your browser.
I was on a Zoom meeting earlier today with a partner and the internet at BOH just completely went down. So I had to send her an email being like, I think we're done with the meeting.
Thank you.
That.
Start without your data, yeah.
The data that I'm going to show you in a second is all of our quantitative data, right? It's from that survey that we've been talking about, but we do have qualitative data too, because my team and I will talk a little bit about this, work directly with students who are currently using. So we have qualitative data, if anyone's interested, that are stories that kind of help give this a little bit more context. Where do you want me to start? On slide. That's good. All right, just to give us some context, because we all like numbers, we all like quantitative data.
Is it shared with Zoom people?
It's in the Zoom chat, people can pull it up.
Oh, okay.
Yeah, they
so
have
we're
it.
just not
I
gonna
can see their
do
names
that.
coming up.
We're not gonna do the share screen.
Okay,
Should you need it?
can folks? I guess.
If you're on Zoom, open it up and follow along, I think is the message.
They can see it too. Their names are popping out.
Okay, so these are some quick charts for you guys. So here we have it broken down by high schoolers, which is grades 9 through 12 and middle schoolers. Each of those bars are a different year. So 2018 is in pink, 2023 is that gray, in between is 2021. And what that is showing us in those bars is that youth vaping since 2018 is coming down in Tompkins County, that our high schoolers are using it more often than our middle schoolers. And this is 30-day use. 30-day use. So this is what we kind of use that as who's using regular. Go to the next slide.
Can you describe what
Yeah.
you mean that they've used it for at least 30 days or they've used it within the past 30
In
days?
the past 30 days. That makes sense?
Yeah.
Okay, so this is another one I just wanted to show you. This is our perception of risk chart. So we know based on the literature that as the youth's perception of how harmful a substance is, the likelihood that they're going to use it goes up. So even if we don't see use rates going up, we pay attention to that perception of risk because it can be as an indicator of what may be happening in the future, right? So this is perception of risk. These are the percentage of students who say there is no risk or slight risk in grades 7 through 12. This is just 2023 data. The middle school, the cigarettes are in gray. So that is the percentage of students who think there is no risk or a slight risk if someone is using cigarettes. The one in the yellow, which was higher, that is the perception of risk of how risky nicotine vapes are. Does that make sense? And on average, we still have a quarter of our students who do not think nicotine vapes are risky if they're using them regularly. And 18% or 19% of our students don't think using cigarettes is risky. And then I have one more slide that I wanted to share, because as we're having this conversation, we're talking about youth nicotine vaping. But what I want to just put out there is that we cannot separate, as much as we'd like to, youth nicotine vaping and youth cannabis vaping, because what we're seeing is that our students are usually buying them from the same places, and that students are just talking about vaping in general. You have to sit down and have a conversation with them, and you're finding that some of the substances that they're using are actually vapes that contain both cannabis and nicotine in the same packaging. So when we're talking about health and public health and education, we need to talk about them together. And when we're talking about access, we need to talk about them together. So the other one I showed you is 30-day use. This is lifetime use for each grade level. And as you can see, the yellow is students who have used nic vapes at least once in their lifetime. So when we get to our 12th graders, about 1 in every 5 have used a nicotine vape at least once, and our cannabis vapes are there in the green.
What's the number responding to the surveys? And have they been consistent over the last years of your data?
So they have been fairly consistent. So I don't have the number off the top of my head, but it's like 4,600 some total for the last survey. I can look that up for you. They have been consistent. We have seen some school districts have less buy-in some years than other years. But across the board, we're getting a pretty solid response rate. All right, that's the data. Now we dig into the real stuff.
So my name is Amber. I'm a health educator here, working for a tobacco-free zone, and then the other half of my role is Healthy Neighborhoods program. I might be looking down a lot because I don't have my glasses. So a lot of the work I do in schools is trying to change that risk perception and also trying to redefine that norm, right? This is something that's commonplace. This is something all my friends are doing, giving youth the facts and information they need to make educated decisions about their health. So the presentation that I give is vaping and how it impacts you and your health. And that's a partnership with Ithaca High School to present to their health classes. So a couple times a year during the fall and the spring, I'll go to their health classes, kind of take that whole lesson plan. And though the presentation itself only takes me about 20-25 minutes, depending on what time of day it is that I have them. So if they're interacting with me or not, we spend the rest of that time answering questions back and forth, trying to make it much more of a conversation rather than just me talking at them, right? So I did recently present to Ithaca High School, and then also LACS during their free period. So their free period was great too, because that was them coming up their own, right? They could have spent that time in study hall, they could have spent that time doing something else, but that was a pretty packed auditorium for that. So the topics include the short and long-term effects of vaping, addiction, so dependence and tolerance, talking to them about that a lot and making sure we destigmatize that. Industry marketing tactics, right? Making it clear that we aren't against the students or against the smoker, but really talking to them about how the tobacco industry targets them in particular, talking to them about the average age a young person starts smoking, which is 13, and they're all always so surprised. And just reminding them that, that they're role models to their younger siblings and younger folks in the community too. And then there's some interactive pieces of the presentation as well. So spot the vape, but there'll be objects on the desk and they'll have to tell me which one they think is a vape versus what's that regular object. And then this graphic here, I always show them too. So comparing what's in a traditional carton of cigarettes versus what that nicotine concentration corresponds to in a Juul, which they're all like, we don't do that anymore, it's old. And then on the film float, and then a lot of them are focused on the Elf bar, which is much more interactive, right? Because it'll have like levels. So depending on how much they're using the product, the levels will reflect on the side and it'll level up, or it has games on the side. A lot of the teachers find that they like the interactive activity of spotting what's in the vape, Because although you're showing the students like different vapes and what they look like, you're showing their teachers too. So it'll be like a watch interface that they can open up and use the mouthpiece for. But it's functional because it tells them the time, or it's a Sharpie that isn't actually a Sharpie. And to Brandy's point, it's really hard to separate the two at times because there'll be options where you can refill the cartridge and it'll be dual sided. So something that looks like a compact mirror or something like that will actually open up where the person can either use, they can fill it themselves. So one side might have nicotine, the other side might have THC containing contents. Another part of our presentation is usually showing them the ingredients that are in these vapes, right? Because it's not regulated. So they'll see something like formaldehyde and I'll always ask them, do you know what this is used for? This is not meant for you to inhale, right? And commonplace things that you might see like zinc and other compounds that yes, ingested a certain way, it's not the same as breathing that in. So really emphasizing to them that these products aren't regulated. So you don't know what's in there, right? And just wanting them to be more educated about what they're taking into their bodies. So another half of my work in tobacco-free zone, and I do work with other folks from Cortland Health Departments, they help spread out to the catchment area, is reality check. So this is made up of teens across New York State who expose the truth about commercial tobacco and marketing practices. So they're kind of the advocates of their school, right? So Dryden has a pretty robust reality check program. The teens host events, they present at meetings, attend trainings, and they design activities to educate the public and to inspire meaningful action to reduce the impact of commercial tobacco. So this photo is us all in Albany. We went to Legislative Education Day. So legislators don't necessarily want to hear from us usually. So State Senator Webb and her staff, these students will go and they'll tell them what they're seeing in their schools, what's going on, their personal stories, right? So we have a good mix of folks that are involved in sports, but then others that are involved in the arts, and they'll talk about just what they're seeing and how that impacts their day-to-day in school. So some of the work that they've done in the past, right? This is kind of, though it's a little bit dated, it's really laid on relationships with different places in the community that's allowed us to do more work. So they collaborated with William George Agency to produce a video documenting its tobacco cleanup efforts across Dryden. So what that looks like a cleanup, right, is they'll go to a park and if there's any litter or things like that, they'll flag it. We don't have them pick it up. One of us coordinators will do so just to keep it safe. But we find that that can be really impactful because those flags will all show up, right? And you'll see them near swing sets or near places that you take your children that you want to be safe. And seeing that visual prompted the Dryden Village Board to ban tobacco use on village-owned properties such as Montgomery Park and village offices. They teamed up with Trumansburg High School, SAD, so Students Against Drunk Driving Club, to lead tobacco prevention initiatives too. This included a student-led research project analyzing local retail tobacco marketing, and they presented their findings, highlighted youth tobacco use concerns, and proposed actionable strategies to the village board. So we really use this club to foster, we don't want to tell them what to say, right? We want to work with them, do these different activities so they can find their voice and then they articulate the findings rather than us doing it. It's more meaningful coming from them. So I spent a lot of time working on this and for prevention. So blurred image, blurred focus when vaping. We really wanted this to be a youth forward activity. So I worked with Brandy and other folks on the Community Coalition for Healthy Youth. And what this looked like was we essentially sent out a survey to youth in different areas. So it wouldn't just be focused in one place in Tompkins County, but be more robust. We asked them about what activities and things they love to do to help inform our photos. And these photos, we would put up the blurred image first, and then after a certain amount of time, switch it out with the clear image just to promote engagement and prolong that. So this made it to community spaces, including the middle and high schools. We started in Dryden and Ithaca as pilot places, libraries, recreation centers, but then we had a lot of pediatric offices interested as well. And that helped us get to parents too with the resources. So the QR code there links to social media, and that'll show the clear image, a photo captioned with a fact about vaping, some quick resources and statistics we took from Clyde and other places to redefine social norms. And we can go over to the next. So this is what it would look like on social media, right? So they would scan it, it would go to their, it would go to Instagram. It shows that blurred image. In this case, a lot of the feedback we got was reading at the park, right? So we wanted to incorporate that. That's buttermilk in the background. Then when they go to the next, it shows keep your focus, not your fix. Baby can be a blur, save your breath for the things you love to do. Save your focus, being able to enjoy sports, being able to sing whatever it is you do, read and concentrate. And then that next, square over includes a fact to redefine social norms. So they're not alone in Tompkins County. 88% of the students in grades 7 through 12 have never vaped nicotine. You don't have to feel like you're missing out on something that your peers are doing, because actually a lot of your peers aren't doing it. And then the bottom, and I cannot read that, but that's one of the facts that we included. So we'll have something about impacting your focus or popcorn lung, different depending on the activity that they're doing.
And back to me, TSU T-Both is doing a lot of prevention too. So we provide K-4 lessons on nicotine. So it starts with, in kindergarten, it starts with something we call Not in My Mouth. So we show them all the things, including dog food and Legos that you should not put in your mouth, but we have now included a vape so that they know that if they see one lying around the house, that it's nothing to put in their mouth, and then everything is grade appropriate moving through there. We do those prevention lessons at the elementary school level at T-Berg, Newfield, and Groton has jumped on board for this school year, so we're super excited. We also do lessons for middle school and high school around stress, nicotine, and cannabis. So really, when we talk with students who are currently using, what I'm hearing time after time is a coping mechanism for stress or other mental health issues. So we build on stress, have a conversation with the students about healthy ways to deal with stress. What does it look like? What does good stress look like? Should we run away from good stress? No. And then we focus on nicotine and help them understand that this is an unhealthy coping mechanism for stress. We also take the Clyde survey that I've shared with you a little bit, and we go and present that data back to the students because we want them to know that we really appreciate them taking it every 2 years, that we're using this data. And like Amber was saying, we want to report back those social norms that most youth are not using these substances. And help for meaningful focus group conversations. We can talk about why they think the data looks the way that they do. And then we do a lot of social groups with an adult facilitator. So it's a lot of coaching in the moment, because we know one of the protective factors for not using nicotine is making sure students have good social skills, that they're connected to a caring adult, that they feel like they belong in the school building. So these lunch groups are able to do that. And students are able to bring real life situations of strong emotions, real life situations of conflict, of just managing social interactions to an adult facilitator that can help them walk them through that. And it provides a good, caring, trusted adult in the school building. Next slide. We also starting to do some positive alternatives. We have a guitar club that we run over at Dryden High School and a guitar club at DeWitt to make sure that there are other alternatives to risky behaviors. And we're working to advocate for restorative substance use policies in our school buildings. So right now, when a student gets caught using nicotine, some of our schools are still seeing that as a punishment-based model where you are suspended. We're trying to have the conversation with our administrators and our teachers that a lot of these students who are caught using during the school day, it's because they're addicted. It's because they can't stop, right? So how do we make sure that there are some consequences because they are breaking a school code of conduct, but then get them attached to the restorative piece that helps connect them to resources so that they can change their behavior and they can have healthier lifestyles. And that's where this comes in. I'm just going to pass this around. You guys can grab some. Next slide. Because that's the prevention. And then we have the next slide shows what we're doing for students who are currently using. So we have this program called Teen Intervene, where a student who's currently using can meet with me or one of my team. We have 2 amazing staff members who have been doing this and go through motivational interviewing to get to the root cause of why they're using and to find better coping strategies and action plans to help them move towards abstinence eventually. But we do use a harm reduction model because we want our students to be successful. So we come up with an action plan on how to change their behavior in a way that makes sense for them. But we always focus on how can we get to a place where you're not using on campus because now it's having disciplinary issues. It's taking you away from your academic studies. So we need to get this under control as soon as possible. So one of the things we're able to do, and I can pass this around, you guys can just see them because I think they're cool, is making sure that we're giving students tools to successfully cut back and to successfully quit. So right now, the tools that I have at my disposal are gum, getting kids chewing just cinnamon gum. We found research that shows that cinnamon gum actually helps the most with nicotine cravings, getting them Jolly Ranchers, getting them fidget toys to get them through class. But these are my new favorite things. The kids really like the breathing necklaces because they need something that they can put in their mouth that gives them the same satisfaction of hitting a vape. And these have been working. These ones are brand new, just got them today. They're actually silicone, and I think they look a little bit more like a vape nozzle. I don't know what you call that. So I'm hopeful that this will be a little bit more useful to our students. We also do referrals out. So if we're talking, and we work really closely with Northeast Peds, if we're talking and we find that our student is a patient at Northeast Peds, we encourage them to go back and talk to their doctor to talk about nicotine replacement therapy if we're finding that they are addicted.
So what am I trying to combat right when I go into schools? The impact of tobacco retail density on youth use. So high outlet density is associated with higher youth tobacco use. The constant visibility of these products, right, reinforces social norms related to use. Well, if it's more common, if it's easily accessible, I can get that. This easy availability of these products seems more accessible, which encourages early use too. It can't be that harmful, right, if it's all around me, that kind of thinking. And I'll get a lot of those questions from the high school students usually too. If it's dangerous, why isn't it? Frequent exposure of tobacco branding, right? Seeing something you recognize, seeing somebody wear a shirt, probably not as much now, but seeing like a youth in like a Newport shirt, right? It's like, wear that to presentation. Increases recognition and appeal among youth as well. And switch over. So some retail policy solutions, education, right? So Tompkins County was actually one of the first counties in the state to adopt T21 in 2017. So that was before it was done at the statewide level. This raised the tobacco sales age from 18 to 21. So this licensing rate has been shown to reduce youth access, right? You see that CDC, Surgeon General's report has reported similar. Controls the products being sold and where these sales can take place. It's effective at reducing tobacco use and youth exposure to tobacco products. So licensing is an evidence-based and sustainable strategy for shaping a healthier retail environment. So the Jewel settlement funds that we're just in, this is the allocation of funds. So Tompkins County has quite a lump sum, and these are our approved uses so far. So this is preventing youth and young adults from initiating vaping, supporting community, school, college, and university-based anti-vaping programs, helping people quit vaping with quit systems and quit line, and enforcing vaping laws and regulations, research and surveillance. So this is still in our early stages here. That lump sum is what we'll get in increments, right, over the course of 7-8 years, something like that. So for now, we're just drafting different ways to meet within these approved uses. So this is what they've laid out as our way to be able to do this. And that's still a work in progress, but working with community partners so that we aren't all using the funds in different places to do the same thing, but making it more meaningful. So either like a continuity, right, where we start picking something up that another group can work with us too, or just making sure that we can spread those resources apart the best we can.
Right, so those are the carrots and this is the stick.
Yeah. The enforcement side of the tobacco and youth world. Oh, yes. Also, I am Alex Dunn. I work for environmental health. Yeah, I do food, but then I also do the Ithaca program, which is what we're going to be talking about right now. So for tobacco and vape enforcement, environmental health follows ATUPA, which stands for Adolescent Tobacco Use Prevention Act. It comes from this public health law, Article 13F, prohibiting, it's going to list a couple of products, but prohibiting tobacco and vapor products to minors. The emphasis is on the sale to minors. We've got other restrictions that fall under ATUPA, but it's all revolving around prevention of selling these products to minors.
So on the left-hand side, we've got a graph showing the non-compliance rate for retailers over the years. I think it starts in 1998. And we can see the gradual trend of decreasing non-compliance. We do see the spike in 2021, possible COVID-related factors, but that was also the time that flavored vapes were prohibited. So, yeah, there's been a lot of kind of nuances in the years following the ban on flavored vapes. I did just see an updated graph yesterday that showed these last few years, and the rate is still up close to that 2021 rate. Is slightly decreasing, but yeah, recent years are still up in that in the mid-teens for non-compliance. On the right-hand side, we've got the Department of Taxation and Finance registered retailers for tobacco and vape products. We can see over time, I think it starts in 2000, that rate is decreasing, the number of registered retailers for tobacco and vape products. So this slide is relevant just to vapes. The tobacco products are relatively straightforward, but under ATUPA, we do have enforceable products and products that we do not take enforcement on. So products that we will always take enforcement on are any vape products sold to minors. Again, ATUPA is really revolving around preventing sale to minors. We will also take enforcement on flavored vapes if they contain nicotine, tobacco-derived nicotine. There is one exception, it's that Enjoy brand menthol. Has to be the Enjoy brand only, has to be menthol flavored. That's what we take enforcement on. Vape products that we do not take enforcement on are synthetic nicotine. They can be flavored if they contain synthetic nicotine. On the shelves, you might see something like SFN or No Nic 6. There's a couple of different synthetic nicotines or nicotine-like alternatives that when you go in and see a flavored vape on the shelf, it's more likely to be a synthetic nicotine. ATUPA, we do not take enforcement on those products. And we also won't take enforcement on a vape if it's unflavored. It'll say clear or it'll say tobacco if it contains nicotine. We don't enforce that or take enforcement on that. So these are the other restrictions that we will take a look at under ATUPA. Again, all centering around preventing sale to minors. These tobacco and vape products must be either behind the counter or in a locked display case, as in you can't walk into the store, reach on the shelf and pick up a product and give it to the clerk. There has to be some sort of barrier between the customer and the tobacco or vape product. Products must be sold in their original sealed packaging. You can't have loose cigarettes for sale. Retailers may not offer deals that promote the sale of tobacco or vape products. No buy one, get one. No fill a tank of gas and get a free pack of cigarettes. No sort of deals or promotions.
Have you seen that one before?
No,
Oh,
that's just, there's some like examples that they give. Yeah, I haven't seen any weird deals or promotions. All Department of Health signage must be clearly displayed. There's an under 21 sign and there's a vaping sign. You can get it straight from the state. And we also give them these signs. So there's no excuse not to have these signs posted. So in order to sell a tobacco or vape product, the retailer needs to get a registration from the Department of Taxation and Finance. That's a state department. You can get a tobacco registration, you can get a vapor registration, or you can get both. They're good for 1 year. You have to keep, you have to have an active, valid permit in order to sell these products. So environmental health conducts at least 2 inspections per year per facility. One of these is, we call it a partial compliance check. That's when it's just myself or an EH inspector going to the facility to look at those other restrictions that we talked about, like the location,
make sure they have the registration, signage posted, things like that. Then we also provide them like the most updated information about Atuba and signage if they need it. Then we will do at least one underage purchase attempt for each facility every year. That's working with an underage person that is working with us, where they will go in, try to purchase an age restricted product. Yeah, hopefully they don't do that. If they do sell, and if they're under Board of Health orders, they'll get multiple purchase attempts throughout the year. When they do sell an age restricted product, that's when environmental health takes enforcement. They'll get sent their notice of violation. They'll have the option to either sign the stipulation agreement or go to a hearing. After either of those happens, the draft resolution is presented to Board of Health for adoption. After adoption, that facility will undergo 3 re-inspections, 3 purchase attempts per year. They'll be under Board of Health orders. And that's when this point stability is relevant. So in addition to the re-inspections, we do have a point system for minor sales. Once Board of Health adopts the resolution following a minor sale, the facility will be assigned 2 points. There is an asterisk with that. If the employee who made the sale has a certificate from this New York State sales training program, they'll only be assigned 1 point. It's kind of an incentive for places to get their sales training certificates, but more often than not, a facility will be assigned 2 points. Then for the next 3 years, they'll be under Board of Health orders not to make any minor sales. If they sell again, or if they accumulate 3 or more points, they will be referred to the State Department of Taxation and Finance for suspension of their tobacco and/or vape registration. If that facility also sells lottery tickets, they'll be referred to the Gaming Commission for suspension of their lottery license. And the suspensions are 1 year. So here are our penalties. First, underage sales, $1,500. Any subsequent underage sales, $2,500. Flavored vapes is a penalty of $100 per unit. And then we've got a $250 surcharge for each violation. Quick note about cannabis under Atuba, or Atuba does not regulate cannabis. Something to keep in mind, retailers, if they have a tobacco or vape registration through Department of Taxation and Finance, then they may not also hold a license to sell cannabis through Office of Cannabis Management. 2 completely different departments. If a retailer holds a license to sell cannabis through Office of Cannabis Management, then they may not hold DTF registrations for tobacco or vape products. We do not. Atuba, Environmental Health, Atuba does not look at cannabis. Finally, we need minor inspectors. We're always looking for minor inspectors. Do you guys know of anyone in this age range, 18 to 19 years? It is nice to have a couple of underage people working with us. We do have, re-inspections on facilities. It's nice to not be recognized. And obviously these people get cycled through quickly just because we do need that specific age range. It is paid. It's not a lot of hours. It's more of a resume builder than an income generator, but yeah, it's kind of cool. It's kind of fun. It definitely requires a specific personality. You're calm, confident, you have to be able to walk in and ask for a age restricted product without an ID. But I'm always inside the facility. Yeah, an adult inspector is always inside the facility. So yeah, if anyone knows of anyone that wants to help us out, then either let me know or Skip, I guess. And I believe that's it.
Thank you. So sort of to wrap us up, first, I want to thank our support team over here. I realize I don't think we told Karan that we were going to have slides before this meeting. There's a lot of cooks in the kitchen behind the Board of Health meeting at the health department. So I'm still learning who needs to be made aware of what. So that one's on me. So thank you guys for troubleshooting it. And then, I think we are gonna sort of do a deep dive on some of the challenges that we have in enforcement. That's on the docket for our next meeting. And again, we'll sort of move into an executive session for that. There are a couple of resources on this side if you all want to do a little bit of reading between now and then, and we do have time for some now. I think the other thing we didn't want to do was spring an actual 2-hour meeting on you all when I think these historically not been 2 hours. So I think we sort of thought we would do a bit of a presentation and then save some of a little bit more of the challenging piece around the discussion around enforcement for the next meeting. But happy to also have a little bit of we've got some time to chat now, if there's questions or anything like that for our great presenters.
The comment, I'm really impressed with the level of youth engagement and responsibility and peer education. It's a nice approach to see versus always being the adults trying to take action. So kudos to you guys. Has that always been the case that you've involved
I find
youth themselves in the program?
I find they respond well to being talked with instead of at, right? So when you're talking to them, they feel like they're a part of that conversation rather than you telling them what they should or shouldn't do.
Yeah.
Which is, we're still doing that, but it's in a different
Yeah,
way,
yeah.
right? It's more informing them.
Yeah.
They still call me ma'am a lot, but other than that.
You should talk to my wife. She needs to be home.
That's what happens when we get old.
I'm a miss, not a man. But good job. It's impressive.
I'm not familiar with synthetic nicotine.
Yeah,
So what's the pharmacokinetics of that? I assume it doesn't have addiction potential.
I have absolutely no idea. And yeah, we know that they're a different compound. I don't know enough about the compounds themselves to know the addiction potential. Just that we don't enforce them.
Maybe we could look some stuff up on that and then have it at the next meeting. That would be interesting. The other question I had was, can you explain the discrepancy in risk perception between vaping and cigarettes?
So, very interesting. I had a conversation with a young gentleman yesterday. So what I'm thinking is happening is we've had decades and decades and decades where we've mastered how to have the prevention, the risk conversation about tobacco, cigarettes, right? And we're having a hard time because as adults, we know that vapes are different than tobacco, right? The FDA has just said that for adults, vaping is a better alternative than traditional tobacco products. So relatively, the risk of the harm is lower, right? So I think we're having a hard time getting you to understand that even though you might not get black lungs from vapes, that is still risky, right? So that's part of it. Part of what I'm also seeing is yesterday I had a conversation and the young man I was talking with, him and his friends knew that nicotine vapes were dangerous. They got that message, right, in their health classes. They got that messages from adults. They said, so you know what we did miss? We've decided that we're moving to cigarettes now, right? So it's like this whack-a-mole, substance use whack-a-mole. It's like we get the messaging down for one and we then are like, oh, but now they're over here. So I think that's a little bit about what's going on as well.
Because your graph showed that more students perceived risk in vaping compared to cigarettes.
It was the other way around. I'm pretty sure that it was the other way around.
So the higher the number, the lower the risk perception.
Sorry?
The higher the number that was shown on the graph, so the higher the bar, right, the lower the risk perception.
Yeah,
So it's the inverse relationship.
yeah.
They're also infused now with like vitamins and things like that too. So I have a lot of students say to me like, oh, it has B12. And I'm like, right, but the other things. And so it's just like I said, it's that constant conversation of reminding them of what's meant to be inhaled, which is not any of the ingredients that they.
To do some like nutritional use.
Heard about vitamin B12.
Yeah.
But we are seeing that the perception of risk of cigarettes are going down.
Yeah.
As well right now.
To your story about moving to cigarettes, would that be part of a future survey about going one way or the other?
Unfortunately, with the survey, it's 100 questions long. And it's a national survey, so to have validity, we can't change too much.
Okay.
But in conversations where I'm talking with students who are using or have previously used, I am asking those questions in like a focus group setting. Yeah.
Run technically, but thank you very much for all of this. I'm gonna put a couple extra pamphlets for my clinic.
Just ignore it.
Yeah.
So pretty, we can see it.
Anything else on this? So this is for you all to ruminate on, and we'll sort of pick up this thread a little bit next month. Well. All right, so now I think we do, well, no, you were leading the agenda.
I realized I hadn't asked, in terms of monthly reports, are we actually talking for monthly reports on this?
We're just gonna do some very top line, I think, some commissioner updates. Dr. K, I don't know if you had some updates, and then I think we're gonna skip, unless you guys had questions
Okay,
about them, and then pick up monthly reports next month.
okay, got it. Do you want me to just go around the room with staff then?
Yeah.
You want to start with you?
Sure.
Okay.
So my update, so as new commissioner, I really continue to meet with staff, to get to know them. To date, I've met with almost every program across the department, which has been really wonderful to sit down with everybody. And I've also started meeting with other county leadership, different legislators, et cetera. For this group, I really wanted to highlight, kind of applaud everyone at the health department on what I think was a really quick response around the incredibly dramatic changing landscape around COVID vaccines. I think our team, sort of Rachel's team and Sam's team, were very quick to try to decipher confusing federal information, distill it down into things that we could share with partners and kind of get that up on the website. And I think we did a really good job of sort of sharing what we knew, being clear about what we didn't know. And then as more things came out, we really quickly developed an FAQ, which is now on our website that kind of speaks to where people can get the vaccine. If they think that there may be a copay, the answer is it depends, or sort of just continuing to update changing information. So I thought that was great. I felt like we were really responsive to the community. We were quick to answer community questions and kind of take what we were seeing as incoming and turn that into an FAQ to try to proactively respond to people's concerns. So that was great. And then the other thing I wanted to touch on is the budget. The whole health budget hearing is this Thursday. We are really fortunate that our budget is not facing significant cuts in this budget cycle. We have a fiscal wizard of Jeremy and his team who are really thoughtful and deliberative in the way that they embed programs and new pilots and things like that into our budget, which allows us to kind of present a more unified budget versus some of other departments who just manage things a little bit differently. So to that end, I think there's also a lot of strong support for public health in our county legislature. So we're really not facing major budget cuts right now. And I wanted to highlight that there is an included recommendation in the county budget for an epidemiologist role for the health department, which we are very excited about. Hopefully that stays in, and then, we'll reach out to you all. I think this won't be till 2026, but when we get sort of a job posting up, we'd love to share it with you all and, share it to your networks as well. And we're excited to sort of think through the different projects that we have for an epi person, and that I think will be a tremendous asset. The one line item we asked for that was not included in the county budget, which I will still be asking for of the ledge, is an environmental health water specialist. Their water work has just really grown, and we know that the more we're able to do preventive testing, the more we can avoid or we can respond to situations that should be boil water orders and protect residents. So I am going to sort of be asking for that, even though it wasn't formally included in sort of what the county budget was. That is my budget update. Jeremy, do you have anything you want to add to that?
So,
So that's it for
So
me.
nothing more on the financial summary? Okay,
nothing to add to what's in there.
okay, great. Any questions on either of those items? What is the epidemiologist gonna sit in one of your divisions, or
Yeah, it's a great question. We're working that
Oh,
out.
okay.
Yeah, I will. It'll sit in the public health side. I think we don't quite know where the home is. I think there's a lot of these cross-cutting roles.
Yeah.
That we need to figure out what the best place is for them.
Okay,
Yep.
thanks. Dr. Piepak, do you have anything to add to your report?
My report started out with quite a brief description of where things were as of August. And I regret to say that they aren't any better. I observed, I should say, the ACIP meeting on Thursday, Friday last week. And also, of course, President Trump's and Commissioner Cameron Kennedy's, Cabinet Member Kennedy's performance last night, which I viewed with great dismay. I'll include a lot more in my board report for next month in terms of what I observed about the ACIP meeting, what I think of it, what the process seems to be. I think the important points for us to emphasize to the public right now is what they heard last night is not supported by science or evidence or good practice, or they should ignore it. This harkens back to the February, March dates of 2020, when we were encouraged to use hydroxychloroquine and inject bleach into ourselves for COVID. It has completely fallacious material in it that is doing great harm to the public's health at this time. We need to be forward in sounding that message, especially right away. And I will do so tomorrow on WHCU. We'll be talking about autism, the concept of using leucovorin in these kids has no real basis in well-done studies. So we can't shrink from touting science and moving forward and doing what we can to counteract messages that are destructive. And with regard to COVID vaccine and vaccines in general, I'm very heartened by Governor Vogel's steps to ensure that COVID vaccine is available to New Yorkers who want it. And the Northeast Consortium of Public Health, which will now be stepping up where the CDC will be failing us in providing scientific basis for our vaccine schedule. Unfortunately, our message to the public now has to be to ignore the federal recommendations and pay more attention to New York State, what New York State says to you, what our departments. I think those are the underlying messages. Questions?
Not a question, but just a comment. I just want to really appreciate you stepping out and especially making the effort publicly on the radio to educate our, the audience, which is our public. I appreciate that you do that every week. It's amazing. And especially now, starting these times, it's really more important. Thank you.
Glad to do it.
So regarding the Northeast Public Health Coalition, is it that all the health departments participating will have a single message, or are we still, we're in New York, we're paying more attention to New York State, and if you're in Connecticut, you're paying attention to Connecticut State Department?
Well, I don't have very deep information about exactly what this involves. It's relatively new in its development, but what I seem to understand is that there will be these several states will be pooling their health resources to create the counterpart to the Advisory Committee on Immunization Practices for the CDC to advise the consortium of states as to vaccine recommendations. And then those states would pretty much be taking that and running with it.
So is it primarily focused on vaccines, or will there be other health initiatives that the consortium will drive?
I know only of vaccines. Do you know other?
I haven't heard about anything else, but I think it's all, I feel like what's been released so far has been very top line. We're together, we're collaborating, we're support public health. So I think we'll keep an eye on this as it continues to evolve and figure out if and how we play a role or.
You can only guess at how much time is having to be devoted to this to, first of all, create an counterpart to ACIP, and then all the policies and procedures, revision of public health laws that will be necessary to facilitate this, because many public health laws reference the ACIP, and creation of New York State regulations and so on. And just a word of praise to commercial insurers that they're tending to a large extent to ignore the recent ACIP actions. And they're stepping up to the plate to say, we're going to honor the prior vaccine schedule. That's big. That's huge.
Yeah.
It still leaves us with the problem of federally driven Medicaid chip care for kids, which is 50% of kids in this country.
Other questions? Okay, Rachel, you're up next.
Nothing much more to add except a lot of conversations about vaccine access and for community. Worked a lot on that FAQ with Shannon. And we're mobilizing to do clinics in the community next month, COVID and flu vaccine at various community sites. So we're working hard on getting ready for all of those. We have our allocation of private paid COVID vaccine and part of our allocation of flu vaccine. We have not yet received VFC or VFA COVID vaccine. There's just a big question mark with that. New York State says, we don't know, we have no idea if it's going to be allocated, what's going to be allocated, when it's going to be allocated. So we do have flu vaccine in-house for VFC and VFA. We do not have any COVID vaccine in-house for VFC or VFA.
So I noticed a positive trend towards the decrease in venereal diseases. Any thoughts on, is it something you guys are doing as far as promotions or?
We're talking chlamydia, gonorrhea, syphilis, all of the above.
Yeah.
Well, I mean, all I know is the trend tends to be when college students are in town and out of town.
I'm looking for the years.
Years. Oh, okay, yes. So I do, there is data showing, sort of less sexual activity overall in teenagers. I don't have a great answer in terms of what is happening at the county level.
It's a good trend to see. Just curious as to thoughts or, different specific actions or awareness programs.
Right.
Yes. Okay, Sam. Sam. Right, Jessica.
I don't have any additional updates.
Okay, and then Liz, is there anything more from environmental health?
There's a lot of changes going on in environmental health, a lot of new people. I want to say it's been a privilege to work with all of you, and I appreciate your commitment and the time and effort that you put to this body. We couldn't do what we do without it. And goodbye.
You're back. I said, don't we say goodbye to?
My last full-time day is Friday. I'll be doing a couple of days through the end of the year, but probably not here.
Right.
So I noticed there are several boil water notices. Where's the supply for those businesses or parks where the water, boil water notices were issued? Are they municipal or well water?
So it depends on the, I think, no, it would not be municipal unless it said it was a municipality, which is extremely rare. So these are, I didn't check, I know there was one that's kind of Dollar General, right? But That one's elementary. Carolyn was a unique situation, right? So they have their own water supply. It's not municipal. They're regulated public water supplies, but they're on their own well, with
Okay.
different treatments and stuff.
And
Same with like the mobile home parks and stuff.
I was just curious. And then when you cite the sale of vapes to minors, is there any communication to other vape shops regarding, you know, we cited this and they're paying X amount of dollars as a fine, sort of a broader communication? Hey, my neighbor across the street got fined, maybe I ought to step up.
So, I mean, I think this will be more of the discussion next month.
Okay.
From what we have heard through some enforcement action, we don't need to communicate that they have their own
Okay.
network. Sometimes they use the same attorney. So I do think that, there's, you know, behind the scenes.
The word is getting out.
communication. But there's issues connected with that can be discussed next.
Thanks.
Right, well, so maybe we can just close the meeting by thanking Liz for the many, many years of work, and it's really been a joy to work with you and watch you help us think through some really, really complicated public health issues in the community related to environmental health. I learned a ton from you actually on this board, even though it might not seem like that sometimes, but learned way more about what environmental health means in public health and why it's important, and have just really appreciated all the conversations that we've had with you over the years. So congratulations. We're gonna see you.
Yes.
And we hope you have something really fun planned. Okay, and that's it. We've covered our agenda, so we'll go ahead and adjourn and see everybody next month. Okay? Thanks. It was great meeting. Yeah.